Hello everybody. Today we will talk about hair loss. Before we start on our video, please like, subscribe, share and leave a comment. If you think that it is an interesting video, please continue watching. So let's get started now. Losing some hair consistently is normal. Be that as it may, when you're losing a ton of hair, it very well may be hard to make sense of what's causing that male pattern baldness, particularly in ladies. More often than not, minor male pattern baldness is only a sign that your body's becoming new, sound ones to supplant the old. Truth be told, losing up to 100 hairs for every day is typical. In case you don't know what's typical for you, it's a smart thought to just focus on what you ordinarily find in your brush or shower channel. What's more, if out of nowhere you're seeing much more, or your pigtail is more slender or you're seeing more scalp, at that point, you might be losing more hair than you should. Making sense of why you're abruptly losing more hair than expected can be precarious because there is a wide range of reasons for balding in ladies. A few, as inherited male pattern baldness, androgenetic alopecia, aren't generally in your control, you get the hand you're managed. Be that as it may, others, similar to footing alopecia or transitory hair shedding, a typical condition called telogen exhaust, can be overseen or even turned around whenever got early. Making things considerably increasingly convoluted, a few reasons for balding in ladies bring about unexpected shedding while others may turn out to be dynamically progressively perceptible after some time. On the off chance that you've seen your hair is dropping out more than expected, looks more slender, or is by all accounts developing all the more gradually, here are probably the most well-known purposes behind balding. 1. Hereditary qualities. At the point when we consider inherited male pattern baldness, we normally go directly to male example hairlessness. Be that as it may, individuals of all sexual orientations are helpless to genetic male pattern baldness. In ladies, the male pattern baldness is typically gathered at the crown of the head, particularly perceptible at the hair part, while it's bound to influence men along the hairline. Even though you can't forestall this sort of male pattern baldness totally, there are medications accessible, for example, over-the-counter minoxidil or finasteride, that can back it off and make hair remain more full more. So the sooner you start treatment, the better. 2. Labor. Typically, your hair experiences 3 significant life stages. To start with, there's a development stage. Second, there's a transitional stage when the developing stops, however the hair doesn't drop out, and afterward, there's a resting stage. At last, after the resting stage, your hair drops out. Be that as it may, during pregnancy, a great many people notice their hair going into quick development mode. That is when everything is in a develop stage because there are floods of hormones, estrogen, that cause hair to develop. Not exclusively is the development arranged to get going, yet additionally, it keeps going longer than typical, implying that ordinary shedding doesn't happen. When estrogen levels return to typical after conveyance, hair continues its ordinary development cycles and begins to shed such thick, detectable hair that gathered in the course of the most recent 10 months. A few ladies experience gentle shedding, yet others experience extreme shedding for a couple of months. This kind of male pattern baldness, actually, hair shedding, is called telogen exhaust, and it can happen a very long time after a distressing or significant life occasion like labor. A dermatologist lets self know. Shedding tops around 4 months after the occurrence that caused it, she clarifies. Baby blues balding is, fortunately, impermanent. So you don't generally need to successfully treat it. Be that as it may, there are approaches to cause your hair look and to feel more full while you pause. For example, search for volumizing shampoos and conditioners that are detailed for fine hair and stay away from items that burden the hair. 3. Changes in anti-conception medication. Going off hormonal anti-conception medication or changing to an alternate sort of hormonal contraception can likewise cause hormone-initiated shedding. Regardless of whether you're simply beginning it, stopping it, or evolving brands, your body can respond by making the hair go into an expanded shedding mode. This is another type of telogen emanation, which implies that it's typically impermanent. You can depend on volumizing items and styling stunts while you trust that your hair will recover its totality. 4. Dietary inadequacies. Making and keeping up sound hair depends on getting strong sustenance. Specifically, insufficiencies in iron, zinc, nutrient B3, niacin, and protein have all been connected to different sorts of male pattern baldness. Treating a nourishing insufficiency, as a rule, begins with a visit with your primary care physician and a blood test to precisely analyze your issue. At that point, your primary care physician may treat your insufficiency with medicine supplements or may allude you to dermatologist for additional direction. 5. Drugs. A few drugs can cause ceaseless shedding. Specifically, those used to oversee hypertension, malignant growth, joint inflammation, and gloom are known to cause male pattern baldness issues. If you figure your prescription might be causing male pattern baldness, check in with your PCP. By and large, this kind of male pattern baldness is transitory. Yet, on the off chance that your male pattern baldness gets constant, your primary care physician might have the option to recommend an alternative medicine that doesn't cause this reaction. 6. Dandruff or scalp psoriasis. At the point when the skin on the scalp is excited and irritated, it's enticing to scratch it. Yet that may make your hair shed more than expected. Dandruff is the most effectively treated reason for male pattern baldness since you can treat it with over-the-counter items, similar to a cleanser containing zinc pyrithione or peeling fixings, for example, classic shampoos or scalp anti-dandruff shampoo. Consistency is the stunt, so it's essential to discover a cleanser and conditioner you sufficiently like to utilize normally. Be that as it may, different conditions can likewise cause irritation and scalp chipping, including seborrheic dermatitis, an increasingly extreme rendition of dandruff brought about by the development of yeast and oil, and psoriasis, an immune system condition that causes thick fixes of skin. Treating these issues may take additional time and exertion than dandruff, so it's essential to check in with a dermatologist if you figure you might be managing one of these conditions. 7. Extraordinary passionate or physical pressure. At the point when you're encountering something unpleasant or horrible, not your everyday pressure, except something important and life-changing like a separation, a demise in the family, a huge activity change, or a major move, you may encounter a brief stop in hair development as your body gets its assets toward getting you through said large occasion. Hairs don't all develop at a similar rate, some are developing, some are resting, and some are effectively being shed. At the point when you have these conditions, your body ends hair development, and afterward, things get restarted and every one of these hairs that have been ended begin to get pushed out simultaneously. Something very similar can occur with physical pressure and injury, such as having a major activity, being hospitalized, or in any event, losing a lot of weight rapidly. Generally, this sort of hair shedding is transitory. Be that as it may, if it irritates you, check in with a dermatologist to study styling changes and items you can use to cause your hair look and to feel more full. 8. Immune system maladies. An immune system condition causes the body to perceive its hair follicles as outside and it assaults them and makes the hair drop out. This could be a condition like alopecia areata, in which the safe framework assaults the hair follicles. Now and then individuals with alopecia areata do see their hair develop back when though it might drop out once more. Be that as it may, if not, dermatologists can help by recommending different medicines, similar to corticosteroid infusion to invigorate hair development. Conditions that fundamentally influence another piece of the body, like thyroid illness, rheumatoid joint inflammation, or sickle cell iron deficiency, can likewise cause male pattern baldness as one of the numerous side effects. Moreover, dermatologist takes note of that lupus can cause some scarring of the hair follicle, bringing about lasting male pattern baldness. These conditions can be not kidding and require a precise conclusion from an accomplished social insurance supplier. So on the off chance that you figure your male pattern baldness might be associated with a basic issue like an immune system condition, it's imperative to converse with your primary care physician. 9. Wearing too tight hairdos over and over again. This can cause footing alopecia. Traditionally, this happens when individuals wear tight twists constantly, yet I've seen it with tight pigtails as well. It can cause dynamic diminishing of the hairline, and if you do it for a considerable length of time, the male pattern baldness may get lasting. It's viewed as a scarring procedure, which can harm the hair follicle hopeless. To help forestall and treat male pattern baldness because of footing alopecia and prompts failing to wear one haircut for a long time and doing whatever it takes not to pull too firmly if you can support it. 10. Warmth styling your hair routinely. Ladies will go to her and reveal to her they have male pattern baldness when truly they have something many refer to as trichorexis nodosa. This is a condition wherein harmed, powerless focuses on the hair shaft cause hair to sever effectively. The reason? Warm harm to the hair from things like utilizing hot instruments and overbleaching. Right now, male pattern baldness isn't really from the root, however, it's from someplace along the pole. Treatment for trichorexis nodosa, for the most part, includes finding and maintaining a strategic distance from the wellspring of the harm, which could be hot apparatuses, brutal synthetic substances, or forceful brushing. Rather, select delicate brushing methods and delicate, alleviating hair items. 11. Overprocessing your hair. Getting incessant perms, synthetic fixing techniques, or loosening up methods, fundamentally anything that utilizations unforgiving synthetics on your scalp and hair, can harm the hair follicle and cause changeless male pattern baldness. After rehashed affronts, the hair follicles just won't develop back. This can make hair seem more slender and might be particularly recognizable on the scalp. You can forestall further harm by maintaining a strategic distance from those brutal techniques and utilizing items intended to help hydrate and mend your hair and scalp. However, on the off chance that you need your hair to develop back, you'll likely need to enroll in the direction of a board-guaranteed dermatologist. There are things you can do to forestall balding. On the off chance that you notice your hair is diminishing and it troubles you, there are some simple approaches to cause it to seem more full and at the same time help forestall more balding or breakage. For example, as self-clarified beforehand, it's critical to wash as regularly as you have to, however no more. Both under and overwashing can influence the volume and feel of your hair. Not washing enough causes the development of items and oil that can weigh your hair down. However, washing also as often as possible can strip the hair of its normal oils, making it increasingly dry and inclined to breakage. Specialists prescribe adhering to washing around a few times each week and changing varying for your specific circumstance. Continuously use conditioner in the wake of shampooing. Conditioner makes your hair shinier and lessens friction-based electricity, the two of which enable diminishing hair to look more full and glossier. In any case, recall, a little goes far, and an excessive will burden hair. Give leave-a shot items. Leave-in conditioners and detanglers help keep your hair saturated for the day and ensure against the impacts of warmth styling that in any case can cause diminishing and breakage. Use hair veils for profound molding. If your hair will, in general, be dry and fragile, an incidental profound molding cover might be exactly what it needs to recapture some life and quality. These can likewise assist hair with looking shinier. Style your hair tenderly, and without heat, if conceivable. Since warmth can make harm the hair that prompts shedding and breakage, it's critical to confine or stay away from heat styling completely. What's more, when putting your hair up, pick styles that don't squeeze your hair or scalp. Styles like tight plaits, fears, and pigtails can be especially harming when worn over and again or for broadened time frames. Treatment for balding is out there. Most instances of expanded shedding will progressively resolve alone without treatment. Be that as it may, if your hair doesn't come back to its typical completion after inside 9 months, see a specialist for an assessment to see if something different is going on. Furthermore, if you have other stressing manifestations such as tingling, torment, consuming, chipping, or redness, you should look for help sooner. See your essential consideration supplier or go straightforwardly to a dermatologist who spends significant time in treating male pattern baldness. They can figure out what type it is and what the correct treatment approach is for you. Notwithstanding changes in items and hairstyling propensities, your primary care physician may endorse topical medicines to treat male pattern baldness, similar to minoxidil, or direct you to an over-the-counter form, similar to Rogaine. They may likewise suggest medications like platelet-rich plasma infusions (PRP), which can be useful for certain patients, self-clarified beforehand. In case you're interested in your choices, check in with your primary care physician or dermatologist. Thank you for watching this video. Hope you like and got an idea for our topic for today regarding hair loss. See you on our next video.